Abduction is moving the bones or limb away from the midline. Abduction is moving the bones or limb away from the midline of the body, while the opposite is adduction, which is moving the bone or limb toward the midline of the body. Rotation is the act of moving the bone around a central axis. The plane of rotational motion is perpendicular to the axis, as when rotating our head. Circumduction is moving the bone in such a way that the end of the bone or limb describes a circle in the air and the sides of the bone describe a cone in the air. Eversion and inversion refer to movements of the foot. Eversion is moving the sole of the foot outward at the ankle, while inversion is moving the sole of the foot inward at the ankle. Protraction is moving a part of the body forward on a plane parallel to the ground. Elevation is raising a part of the body. Depression is lowering a part of the body. Opposition is movement that occurs only with the thumb and is unique to primates. It occurs when the tip of the thumb and the phalanges are brought together. The action allows us to use tools as when writing with a pen. Reposition occurs when the digits return to their normal positions. Movements at synovial joints. Say flexion/extension and hyperextension. B abduction/adduction. C circumduction. Movements at synovial joints. The figures shows the eversion/inversion, protraction/retraction, depression/elevation, dorsiflexion/plantar flexion. The following movements can occur at diarthrosis or synovial joints. Flexion is the act of bending or decreasing the angle between bones. Extension is the act of increasing the angle between bones and is the opposite of flexion. Hyperextension increases the joint angle beyond the anatomic position. The hinge joint is structured in such a way that a convex surface fits into a concave surface. In this type of a joint, motion is limited to flexion and extension in a single plane. Two examples are the elbow and knee joint. Because motion is restricted to one plane, these joints are also called uniaxial hinge joints. Other uniaxial hinge joints are the middle and distal phalanges of the fingers and toes. The pivot joint is another uniaxial joint because motion is limited to rotation in a single plane. The joint is constructed in such a way that a pivot-like process rotates within a bony fossa around a longitudinal axis. One example is the joint between the atlas vertebra that rotates within the bony fossa of the axis vertebra.